Personality disorder. Personality disorders are a group of mental health conditions characterized by inflexible patterns of thinking, feeling, and behaving that cause distress or difficulty in relationships, work, and daily life. These patterns usually begin in adolescence or early adulthood and differ significantly from cultural and societal norms. 1. Types of personality disorders. Personality disorders are categorized into 3 clusters based on common traits. Cluster A. People with these disorders often appear strange, withdrawn, or distrustful. Paranoid personality disorder. Extreme suspicion and mistrust of others. Schizoid personality disorder. Emotional detachment, limited social relationships, and little interest in others. Schizotypal personality disorder. Odd thinking, strange speech patterns, and unusual beliefs. Cluster B. Characterized by intense emotions and difficulty regulating behavior. For antisocial personality disorder, disregard for others' rights, lack of empathy, manipulative behavior. 5. Borderline personality disorder. Intense fear of abandonment, mood swings, impulsivity, unstable relationships. 6. Histrionic personality disorder. Excessive attention, emotional overreaction, need for approval. 7. Narcissistic personality disorder. Grandiosity, need for admiration, lack of empathy, arrogance. Cluster C. People with these disorders often feel anxious, fearful, or dependent. 8. Avoidant personality disorder. Fear of rejection, extreme shyness, avoidance of social situations. 9. Dependent personality disorder. Extreme need for reassurance, difficulty making decisions, fear of being alone. 10. Obsessive-compulsive personality disorder. Perfectionism, rigid control, excessive focus on rules and order. 2. Causes of personality disorders. The exact cause is unknown, but research suggests a combination of genetic factors, family history of mental health disorders increases risk, brain structure and function differences, environmental factors, childhood trauma, abuse, neglect, or exposure to violence, parental influence, overly strict, neglectful, or inconsistent parenting, unstable relationships, repeated experiences of rejection or abandonment, psychological factors, poor emotional regulation, maladaptive coping mechanisms developed in early life. 3. Symptoms of personality disorders. Symptoms vary depending on the disorder, but common signs include emotional symptoms, intense mood swings, extreme fear of rejection, lack of empathy. Behavioral symptoms, risk-taking or impulsive actions, manipulative or deceitful behavior. Excessive need for admiration. Social symptoms, difficulty maintaining stable relationships. Fear of social interactions, extreme attention seeking. 4. Prevention of personality disorders. While personality disorders cannot always be prevented, certain actions may reduce the risk. Early intervention. Therapy for children showing early signs of emotional instability, social skills, training to improve interpersonal relationships, healthy parenting, providing a stable, loving environment, encouraging emotional expression, and healthy coping skills. Mental health awareness. Seeking help early for anxiety, depression, or trauma. Reducing stigma around mental health care. 5. Treatment for personality disorders. Personality disorders are challenging to treat due to deep-rooted behaviors, but therapy, medication, and lifestyle changes can help manage symptoms. Psychotherapy, the most effective treatment, depending on the disorder. Cognitive behavioral therapy helps recognize and change negative thought patterns. Dialectical behavior therapy, specifically for BPD, teaches emotional regulation and coping skills. Psychodynamic therapy explores past experiences and how they shape current behavior. Medication, antidepressants. For mood, instability, and depression, mood stabilizers. For impulsivity and mood swings, antipsychotics for severe symptoms. Lifestyle changes, stress management techniques, regular exercise to stabilize mood, building healthy relationships with supportive people. Hello, and welcome back to our channel. Today we are discussing personality disorder. Personality disorders are a group of mental health conditions characterized by inflexible patterns of thinking, feeling, and behaving that cause distress or difficulty in relationships, work, and daily life. These patterns usually begin in adolescence or early adulthood and differ significantly from cultural and societal norms. We will cover types, causes, symptoms, prevention, and treatment of personality disorders. Before we dive in, remember this video is for educational purposes only and is not intended to diagnose or treat any condition. With that said, let's begin. 1. Types. Personality disorders are categorized into 3 clusters: A, B, and C, based on common traits. Cluster A, odd, eccentric disorders. People with these disorders often appear strange, withdrawn, or distrustful. The 3 disorders in this cluster are paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Cluster B, dramatic, emotional, erratic disorders. People with these disorders often have intense emotions and have difficulty regulating their behavior. The 4 disorders in this cluster are antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Cluster C, anxious, fearful disorders. People with these disorders often feel anxious, fearful, or dependent. The 3 disorders in this cluster are avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. 2. Causes. The exact cause of personality disorders is unknown, but research suggests a combination of genetic factors, brain structure, and function differences, environmental factors such as childhood trauma or abuse, parental influence, and psychological factors like poor emotional regulation. 3. Symptoms. Symptoms vary depending on the disorder, but may include intense mood swings, extreme fear of rejection, lack of empathy, risk-taking or impulsive actions, manipulative or deceitful behavior, excessive need for admiration, difficulty maintaining stable relationships, fear of social interactions, and extreme 4. Prevention. While personality disorders can't always be prevented, early intervention, healthy parenting, and mental health awareness may reduce the risk. 5. Treatment, therapy, medication, and lifestyle changes can help manage symptoms of personality disorders. Psychotherapy, or talk therapy, is the most effective treatment and may include cognitive behavioral therapy, dialectical behavior therapy, psychodynamic therapy, and others. Depending on the disorder, medication, such as antidepressants, mood stabilizers, and antipsychotics, may be prescribed. Lifestyle changes like stress management, regular exercise, and building healthy relationships can also help. Remember, seeking help is a sign of strength. If you or someone you know is struggling with a personality disorder, reach out to a mental health professional today. That concludes our video on personality disorder. If you found it helpful, please share for more mental health content. Thanks for watching. Take care and see you next time.